An opportunity for discussion. This is the 15-Minute Wonder on South Waves Radio.
Hello everybody, welcome back to Dr. Chan's Minor Ailments Forum. So if you tuned in last week, you might recall us talking about chickenpox. So apart from the fact that chickenpox is quite a common minor ailment, but it also has a very close link to the topic that we're going to talk about, which is shingles. So if you missed the show last week, I'm just going to do a quick recap on the topic chickenpox. So both chickenpox and shingles are caused by the same virus, which is herpes zoster virus. And once you have chickenpox, the virus tends to stay in your spinal cord in dormant. It wouldn't cause any problem at all normally, but sometimes when you're run down or having a low immune system, or sometimes for no reason whatsoever, the virus might get reactivated, which normally would affect a nerve in your body. And this is what we call shingles. So why am I talking about shingles this time? It's because for the past few weeks I've noticed quite a lot of people presenting with shingles, but presented really rather late. So they might have had a problem for several weeks, but they're not sure what that presentation represents. So they just left it. They thought that, it's been really good weather, summertime, I've been out in the garden, maybe I got bitten and I have a rash. And the thing is, if you don't get it treated, it can potentially cause quite a few complications. It might not be serious, but definitely a bit annoying if you do have the complications, because firstly, the symptom might last for a while, and secondly, it can cause a really painful rash that might be there for quite some time. So you might ask, how is shingles actually like? Because you might have heard about it, but you've never seen one. So first of all, we'll talk about the presentation first. So as I mentioned earlier on, it does affect generally a nerve. And most of the time it's only affecting one nerve. So what you would see would be a rash that's generally found on one side of the body. The reason for this kind of distribution is because of the way that our nerves are distributed. It always starts from the midline going to either left or to the right. So if you have noticed a rash that's presented in the way that I described, then it might actually trigger you to think, have I actually got shingles? Now, although I said that it generally affects one nerve only, but it's not always the rule. In some circumstances, you might see the neighboring nerves being affected as well. So apart from a rash, you will also notice it's rather painful. And another interesting fact is that sometimes people present it with the pain first before any rash coming up. They would describe the pain as really kind of like a burning sensation. And the rash will come on like blisters that's very similar to chickenpox. But the difference is not widespread, so it's generally along a line, as in along a nerve distribution. So very similar to chickenpox type of rash, it will come up with blisters, then they will tend to scab and dry off and eventually fade away. So from the onset of the symptoms to the rash fading away, it generally takes around 2 to 4 weeks. Apart from a rash, sometimes people feel a bit run down, feel that they have a slight temperature, and might even have some sort of cold-like symptoms for a few days. So when I was preparing for this show, I read further into shingles, and I was actually surprised. I was surprised by the fact that this is more common than I thought it was. It affects 1 in 5 people in their lifetime, and it can affect any age, not just anyone who's old. And the thing is that once you have shingles once, doesn't mean that you won't have it again, because the virus can be reactivated several times for different reasons. So you might have it more than once in your lifetime. Right, so let's talk about the potential complications that I worry about. So apart from superficial infection on the blisters that you might need antibiotic, the one that I worry about is a condition called post-herpetic neuralgia, or in simplified term PHN. This is quite a common complication, and PHN actually means once the rash is gone but the pain still persists. According to study, it can affect 1 in 4 people who has had shingles. This as a complication is more common in those who contracted shingles over 50 plus. It can last more than a month sometimes. Well, it doesn't always happen directly after you had the shingles. Sometimes you might notice that the rash actually faded away, and after several weeks or months, the pain comes back again without any rash. Different people suffer from post-herpetic neuralgia differently, and some people might complain that it is a moderate pain, but it can be rather severe in some cases. The pain would be very burning in nature, and most people would describe the skin become extremely sensitive. So the most common presentation would be someone who has shingles and then came in and said, I can't sleep at night because even the bed sheet brushing past my skin causes severe pain. Now, why does it come on as a complication? I have to say that no one really quite sure why, but there's some theories out there stating that it could be related to the inflammation of the nerve or the inflammation or swelling of the nearby structures, for example, the soft tissues, causing a nerve irritation. Now, you might say, how can I prevent it, or how can I make sure that I don't have this complication? Well, the good news is either with or without treatment for the shingles, the pain will eventually go away. But without treatment, it will last longer. For example, if you don't have any treatment for shingles, 3 out of 10 of these patients after 1 year might still have pain. So the mainstay of the treatment is to provide the patient a medication called antiviral. So one of the examples is called acyclovir. Now, we have to bear in mind that these antivirals don't actually kill the virus, but it stops the virus multiplying. And that hopefully can help to reduce the risk of post-herpetic neuralgia. Now, there's been saying that the effectiveness of these medications are related to when you start the medication. So let's just say if you presented relatively early with the shingles episode, let's say within the first 5 days, then these medications tend to be more effective when compared to someone who has had shingles already but still have pain 3 to 4 weeks after. So if they presented at that time, these medications might not make any difference at all. Well, in that case, you have to think about some other medication, not to get rid of the virus or to stop the virus multiplying, but to actually control the symptoms. So most important thing is pain control. For example, over-the-counter paracetamol, or if your pain is a little bit more severe, codeine and paracetamol combination, or even a non-steroidal anti-inflammatories like ibuprofen, etc. Calamine lotion may be something of use because, as I said earlier, the skin is very irritated and inflamed, so maybe using calamine lotion might be able to soothe the skin a little bit. And also, as a general measure, if you do have shingles, it's worth to wear some loose-fitting clothing so it doesn't actually rub onto the skin as much. Now, unfortunately, quite a lot of the time, these patients who have shingles actually complain of really severe pain on their skin. So there are other pain control or other nerve pain medications that are available in these sort of situations. So the simplest thing would be a stronger pain control, for example, higher dose of codeine or even morphine-based medication, as well as other non-steroidal anti-inflammatories that are stronger than ibuprofen, for example, naproxen or diclofenac, etc. But obviously, you have to go and see your GPs in order for them to assess the severity of the pain and what medication would be suitable for you. And now we touched on to nerve pain medications. I would just like to mention 1 or 2 of these medications that are of use in shingles. So the number 1 medication that I want to talk about under the umbrella of nerve pain medicine would be Gabapentin. Now, this medication is normally used for epilepsy at a higher dose, but at a lower dose, for example 100 to 300 milligrams 3 times a day, is normally used for nerve pain, and its action is to stop the nerve impulsing causing pain. Another medication that's interesting to mention would be tricyclic antidepressant, for example, a medication called amitriptyline. So this helps with the nerve pain as well, and also help the patient to sleep better. And once again, this medication can be used for different things at different doses. So the dose that we use for nerve pain is much lower than when compared to someone who's on this medication for depression. And according to resources, 8 out of 10 of people who had shingles and also tried these medications mentioned that they had benefited from these medications. However, it's generally take up to several weeks to work. Now, lastly, I just want to talk about preventions of shingles. Because the old saying, prevention is better than cure, is actually true. Since September 2013, shingles injections are offered to 70 to 79 years old patients in the UK. Well, according to NHS choices, anyone aged 70 can have the shingles vaccine on the NHS. It's counting from the first day of September after your 70th birthday for the following years. Now, I must say the system sounds a bit complicated to me because until August 2015, this injection is available routinely as part of the NHS vaccination program for people aged 70, 78 and 79. And once again, it becomes eligible for these on the first day of September 2014 after you've turned 70, 78 and 79. Until last day of August 2015. And from September 2015 onwards, it is eligible for patients who are 71, 72 and 78. Now, interestingly, anyone more than 80 years old are not suitable for having shingles injection because it's been proven that it is less effective in this age group. So it is actually best to boost the immunity when you're slightly younger in order to protect you in the long run. Now, apart from age group, there are certain people who cannot have these injections. For example, if you're known to have allergic reaction to the substance in the vaccine, if you have a weakened immune system, or if you're allergic to chickenpox vaccine as well as untreated TB. So my take-home message for shingles would be this. Number one, if you present with a rash that's on one side of your body only, rather itchy and painful, then you definitely need to go and see your GPs to see if this could be shingles. Then he or she might be able to give you a medication called antiviral medication to prevent a complication like post-herpetic neuralgia. Now, but once again, bear in mind that this is very contagious, especially to those people who are waiting in the waiting room. They might have weakened immune system and they might catch it from you. So if you do suspect that you have got shingles and you want to be seen by a doctor, always mention to the receptionist so that a spare room can be organized for you until the doctor calls you. So if you're in the age group that are eligible for shingle injection, I would highly recommend you to take that up. It is generally available around September to October time, if I didn't remember it incorrectly, as the complication of shingles can be rather unpleasant. So here comes the end of the program, and I hope that you have enjoyed it. I always want to interact with the audiences, so if you have any advice on any topic that you would like me to talk about, please don't hesitate to write to the radio station. And please feel free to leave your name so I can give you a shout out in the program. Until then, take care of yourself and we'll meet again next week. Bye bye.
An opportunity for discussion. This is the 15-Minute Wonder on South Waves Radio.